This medication contains a combination of 2 antibiotics and is used to treat certain serious bacterial infections that have not responded to treatment with other antibiotics, resistant infections. It belongs to the class of antibiotics called streptogramins, and works by stopping the growth of bacteria. The daily dosage and optimal timing for taking Synercid Vial will depend on the specific condition being treated, so it's important to follow your doctor's instructions. This medication is administered through a vein, as directed by your doctor, usually 2 to 3 times a day, every 8 to 12 hours. It should be injected slowly over 1 hour. The dosage is determined by your medical condition, body weight, and response to treatment. If you are administering this medication at home, make sure to learn all preparation and usage instructions from your healthcare professional. Before using, check the product visually for any particles or discoloration. If you notice either, do not use the liquid. Also, learn how to store and discard medical supplies safely. For the best results, use this antibiotic at regular intervals. To help you remember, use this medication at the same times every day. Continue using this medication for the full duration prescribed, even if symptoms improve after a few days. Stopping the medication too early may cause the infection to return. Inform your doctor if your condition persists or worsens. Some common side effects of Synercid Vial may include nausea, vomiting, diarrhea, and headache. However, many people using this medication do not have serious side effects. It's important to tell your doctor if you develop redness, swelling, pain, or warmth at the injection site, as well as serious side effects such as joint or muscle pain, yellowing of the eyes or skin, blood in the urine, or chest pain. Additionally, be aware that this medication may rarely cause a severe intestinal condition due to a bacteria called C. difficile. Symptoms of this condition include persistent diarrhea, abdominal pain, and blood or mucus in the stool. If you experience these symptoms, do not use anti-diarrhea or opioid products. Prolonged or repeated use of this medication may result in oral thrush or a new vaginal yeast infection. Contact your doctor if you notice white patches in your mouth, a change in vaginal discharge, or other new symptoms. In rare cases, a very serious allergic reaction may occur. If you notice any symptoms of a serious allergic reaction, such as rash, itching, swelling, severe dizziness, or trouble breathing, seek medical help immediately. Remember, this is not a complete list of possible side effects, so if you notice any other effects, contact your doctor or pharmacist. And if you experience any side effects, be sure to discuss them with your doctor. Before using Synercid Vial, make sure to inform your doctor or pharmacist if you have any allergies, especially to other streptogramin antibiotics. This medication may contain inactive ingredients that can cause allergic reactions. It's important to discuss your medical history, especially if you have liver problems or high levels of bilirubin in your blood. It's also important to note that this medication may affect the effectiveness of live bacterial vaccines, so be sure to inform your healthcare professional if you are using this medication before getting any immunizations or vaccinations. If you are planning to have surgery, inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. During pregnancy, this medication should only be used if clearly needed, so it's important to discuss the risks and benefits with your doctor. It is not known if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of how Synercid Vial can interact with other medications you may be taking. This could affect how those medications work in your body and increase your risk of side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor. Synercid Vial may slow down the removal of other medications from your body, which can impact how they work. Some examples of drugs that may be affected include certain antiarrhythmic drugs, cyclosporin, certain macrolide antibiotics, and certain antipsychotics. Be sure to discuss any concerns with your healthcare provider to ensure the safe and effective use of this medication. If someone has taken too much Synercid Vial and is experiencing severe symptoms like fainting or difficulty breathing, it's important to seek emergency help by calling 911. Otherwise, contact a poison control center immediately. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control centre. Make sure to undergo lab and/or medical tests, such as liver function tests, while using Synercid Vial. It's important to keep all medical and lab appointments and consult your doctor for more details. Make sure to take each dose of Synercid Vial as directed by your doctor. If you happen to miss a dose, it's important to consult with your doctor or pharmacist to establish a new dosing schedule. Do not take a double dose to make up for a missed one. Be sure to consult the product instructions and your pharmacist for specific storage details. It's important to keep all medications out of reach of children and pets. When it comes to discarding this product, do not flush it down the toilet or pour it into a drain unless instructed to do so. Make sure to properly discard this product and it is expired or no longer needed. If you're unsure about how to do this, consult your pharmacist or local waste disposal company for guidance. If you need more help, call your doctor for medical advice. In the US, you call FDA 1-800-FDA-1088. In Canada, you may call Health Canada 1-866-234-2345. Wishing you good health. Thanks for watching.